Trisha, I appreciate it. Welcome everyone. We appreciate everyone tuning in and logging in today for our webinar series. Today we'll be going over substance use disorder services through OCHN. If at any time you have any questions, as Trisha said, please feel free to put them in the chat. I will do my best to stop on occasion and ask her if there are any questions, and she will read them off to me. Or again, if you are on the phone, you can unmute yourself when I stop and ask questions at that time as well. So we will get started. There we go. So again, hello, my name is Megan Phillips. I am the Access Supervisor for Oakland Community Health Network. I've been in the substance use field for about 10 years. Previous to coming to OCHN, I was at residential substance abuse providers. And so that is where I've spent the majority of my career before coming here. All right, so a little bit about us here at Oakland Community Health Network. We are the public mental health system for Oakland County. We are community-based, a local public entity, and we manage specialty support and services to individuals with serious mental illness, serious emotional disturbances, intellectual and developmental disabilities, infants with mental health, and also those with a substance use disorder. Our mission statement is to inspire hope, empower people, and strengthen communities. One of our main overall goals when we're working with any individual is to help them live a self-directed life by providing choice. It's so important when we look at the treatment options for an individual. Our philosophy is one where we ensure they understand what their options are and they have a choice with selecting whether it be a provider that they attend or based on the services that they're eligible for, then they're able to select that choice. You can see some of the numbers in regards to people that we serve. Last year, we served about a total of 26,000 people in our system, and about 7,300 of those were those with a substance use disorder. So OCHN is a PIHP and a CMHSP. And so what essentially all that means, as the PIHP, we are responsible for managing all the Medicaid services related to behavioral health, developmental disabilities, and substance use disorder services. Also with SUD services, we also receive block grant funding from the state as well. So we don't just have Medicaid dollars we work with, we also have block grant dollars. As a CMH, we also provide services and supports to people either directly or through contracts with our provider network. And so for those of you who cannot see this, if you have called in, what we're seeing now is a map of Michigan. For the state of Michigan, there's a total of 46 CMHSPs. And for the PIHP, there are 10 for the state of Michigan. So it's also important to know with the PIHPs, not every PIHP operates in the same manner. It's very much specific to the region and the needs of how a PIHP may operate. So the system for accessing services in Oakland County, it can be different if you were to go to another county. So that's always just good to be aware of. So in terms of our funding and service delivery, our funding for Oakland Community Health Network, it comes from the Michigan Department of Health and Human Services, as well as Oakland County. We receive funds from them as well. And then those funds come down to us. And we have contracted providers. We have core provider agencies that we contract with, and then also direct service providers. When it comes to funding for SUD services, we are able to assist individuals who have no insurance, Medicaid, HMP, and even those that have third-party insurance as well. So for some individuals, they may have a private insurance, say Blue Cross Blue Shield, their out-of-pocket costs for treatment, deductible co-insurance, whether it's residential or outpatient, they may have to pay thousands of dollars out of pocket before insurance will kick in and fully cover services at 100%. And for some people, that's not financially feasible. And so when that is the case, we review all their funding, and we review their insurance benefits, and we look at and see what's their income, what's the cost. We look at everything overall, and we're always looking at the end of the day, how can we service someone? So we do step in, and we are able to use block grant funding dollars for that. So to kind of talk about substance use disorders and addiction, we use those terms very interchangeably a lot. A substance use disorder is defined as a disease that affects a person's brain and behavior and leads to an inability to control the use of legal or illegal drugs or medications. And then in terms of addiction, the definition is a disease involving interactions among brain circuits, genetics, environment, and individual life experiences. So a lot of times when people say, what does substance use look like? I say, well, it's different for every single person because it affects everybody differently. You might have one person who is able to function in their daily life even though they are using a high amount of substances. Whereas somebody else, they may experience things such as loss of work, family discord, and people no longer speaking to them. And so it will look different for everybody. What I always like to explain to people when it comes to the disease of addiction as well is it's that loss of control and an inability to control. And that's always very much a topic for debate with many people. But the best way I try to describe it is when you look at an inability to control, when you think about the neurons in the brain. When somebody is in their active addiction, those neurons in the brain are what are firing off all the time, saying more, more, more. I need this substance. I need this substance. That is not something that a person can control. That is those neurons in the brain firing off those messages. So that's always something that's so important that everybody works to understand, because then that's where the stigma comes into play. Many people with a substance use disorder, they feel the stigma out there. They feel as though they're labeled as a bad person or they can't get better, when really that is not the case at all. And so the more everyone is able to understand about addiction, learn about addiction, and truly understand that it is a struggle, it's not a choice, and it's something that people struggle with, you know, the more that people can be welcoming and opening to understanding recovery does happen. It truly does. So in terms of privacy of health information, so I'm sure everyone is aware of HIPAA. And that is what establishes the safeguards to ensure privacy of an individual's protected health information. When it comes to SUD, we have another piece that's called 42 CFR Part 2. And what that means is there must be written consent by an individual in order for there to be any disclosure made regarding any substance abuse services. So that means we have to have a written release. So we cannot take verbal permission from someone. There has to be a signed release of information. So for anybody who may work in the court system or being a part of probation or parole, if you have that person with you in your office and they haven't signed a release yet, but they're saying, hey, but no, I set my intake, let's call the provider and they'll confirm, I'll tell them they can tell you that information. The provider won't be able to do that without that signed release. That is a federal law and it's very much stricter than normal HIPAA. So when it comes to our substance use disorder services that we offer for Oakland County, it's important that I first notate that when it comes to outpatient services, a person is able to access those services through the front door of any of our contracted outpatient providers. So it does not require that they contact Access first. It does not require a screening. We have our list. We have a brochure. It's posted on our website. And I'm sure Tricia as well can post it in our link or have it connected with this. We have our brochure. It lists all of our contracted providers, and a person is able to call that provider directly and say, I'm interested in outpatient services, and they will schedule that intake appointment with them. Outpatient services can consist of different intensity of services. So some providers will offer early intervention services. This might be for someone who they don't know for sure yet. Do I or don't I necessarily have a problem? They may have experienced something recently. Maybe it's a loved one just said to them, hey, it seems as though you're drinking a lot. Person said, well, I never really thought about that. Early intervention, we call that it's psychoeducational services. Usually it starts off with about 8 sessions, and it's someone who is able to learn more about addiction, what it is. They'll have a few individual sessions. If at the end of those 8 sessions, the person and therapist say, yeah, there is something more going on, then they can move over into full outpatient services. Outpatient services generally can consist of one individual session per week. Groups could be once per week or once every other week. It all depends. When a person goes into outpatient, they will have a full assessment done at that outpatient provider. And when they have that assessment, that's when the treatment plan is determined, as well as the intensity of services is determined. So that's when it'll be decided, would it be early intervention? Would it be outpatient? And how much outpatient? How many individuals per week? How many groups per week? Or it's when the need for IOP, intensive outpatient services, could be determined as well. Also, what is offered at all of our outpatient sites, we have case managers. They assist with transportation, housing, financial, budget, food, really any of those life pieces someone might need assistance with that's not specific to the therapy side. A person's primary therapist is going to be working on the therapy pieces, and that case manager is going to look at a person's life and sit down with them and say, is there any other areas that you need assistance with to become more stable? And then also we have peer recovery coaches. These are people who are actively in recovery. They are showing that recovery does happen. And we find that most of the time when you have a peer recovery coach who's working with someone who's early on in recovery, that person who's in early recovery, they're really able to relate to that peer recovery coach. That peer recovery coach has been there. They have been in the same place of early recovery and they understand what the struggles are. So they're able to be connected with a peer coach. Peer coach in person will decide how often are we going to meet? Are we going to meet out in the community? What exactly are the needs? But it's really somebody that they're able to connect with on a daily basis if needed to help assist with recovery at all. And with there, I'll take a quick pause. Do we have any questions?
I don't have any questions in the chat. I did link the provider directory and the link to our SUD page with the brochure. If anybody on the phone has any questions, you can select *6 to unmute yourself and ask any questions.
All right, I will move forward then. So in terms of our higher level of care services, so that would be recovery housing, medication-assisted treatment, withdrawal management, also known as detox, as well as residential services. We refer to those as higher level of care services. All of those require an access screening for the person to be able to access those services, be found eligible, and then be connected with their intake appointment. So if a person feels as though they need any of these higher level of care services, they call our main access number. They speak to one of our support staff who enters them into our EHR, runs through a list of eligibility questions, and then schedules them for a screening. When it comes to recovery housing, we offer recovery housing, and it's also coupled with outpatient services as well. Recovery housing is wonderful for someone who needs continued structure to, work with a house manager, and you still are helped and you have tasks to do every day. In terms of the recovery house will require that you attend meetings, and you engage in that outpatient therapy. So it's a great way for someone to still be held accountable for their recovery process and help them maintain that healthy lifestyle. In terms of medication-assisted treatment, all of our medication-assisted treatment providers, they offer 3 different types of medication, methadone, Suboxone, or Vivitrol. And that the determination of which medication a person receives is all made by the doctor and the person. So once we find that a person is clinically appropriate and they meet the ACM criteria for medication-assisted treatment, then we set them up. Individual will have an intake with the doctor, and the doctor will do things like run blood work and make sure and talk to that person about, here's what we have found, here's what we think, and medically is my opinion of what I think is most appropriate for you, but also what is it that you're thinking? Again, the person does have that right to make a choice and talk with the doctor about which medication they'll be receiving and which medication they would prefer. In terms of withdrawal management services, we have multiple withdrawal management providers. We typically couple that with residential treatment as well. Again, withdrawal management and residential require that access screening. It's also good that I notate here as well, any of the screenings we do at the access level, they are just that, they are screenings. So we get the questions a lot sometimes of people calling saying, I need an assessment done. Assessments don't occur at the access level. What we do is we're identifying if someone meets the ACM criteria, the American Society of Addiction Medicine. We're looking to see if they meet the criteria that's been laid out to go into that higher level of care service. Once a person arrives to withdrawal management, residential, MAT, recovery housing, outpatient, the provider, again, just as with outpatient, the provider does the full assessment. So withdrawal management can range anywhere from 3 to 5 days. It just depends on the person's drug of choice, the symptoms, the doctor evaluation, and then residential treatment can be funded for up to 30 days for short term, and then we also have long-term residential treatments that are available as well. And then, of course, residential treatment is a 24-hour live-in setting, and it's offering typically a minimum of 20 hours of therapy services per week.
Megan, we have a question in the chat.
Yes.
Is the medication available for those in housing?
So in terms of medication-assisted treatment, an individual can be in recovery housing as well as be on a medication-assisted treatment. It might depend. Some instances, it's a matter of us having to care coordinate a little bit. 9 times out of 10, the medication can't be kept on site at the recovery house, which is fine. A person then goes to their MAT provider daily and they'll dose on their medication. And then also we will have at times, depending on someone's need, we are able to have somebody on a MAT medication. And the MAT medication, the typical standard is that it's for opiate use disorder. So say I have someone who's receiving that for a MAT medication for opiate use disorder. But say they're struggling with another substance as well, whether it's cocaine, alcohol, benzos, and we identify that there's a possible need for a higher level of care in residential or to detox off of alcohol or benzos. We are able to put somebody, again, as long as they meet ASAM criteria, we are able to put them into a higher level of care, detox residential service, and they are able to maintain their MAT medication while in that provider as well. Not every single residential provider is able to maintain a person on MAT medications, but we do have a very core list of providers who that is their standard practice of being able to do that. So we do have that availability. Any other questions, Tricia?
Nope, just that one.
Perfect.
Thank you.
All right, so women's specialty services. This is also very important to know. Pregnant women, women with young children, men as well who are the primary caregivers. We offer specialty services for them. And so that means for residential services, if it is a man or a woman who's the primary caregiver for the children, and they would have no other option but to take their children with them into a residential treatment center, we have a provider who's able to do that. Also with pregnant women as well. Pregnant women are our highest priority population we service. They are at the most high risk. And so our standards that we meet with the state, we provide a screening within 24 hours and we have them placed in treatment within 24 hours. And that it's whether it's medication assisted treatment, detox, res, we have them placed within 24 hours. And then also at the outpatient level, we also offer, we have a women's specialty outpatient program that is specially designed for the women or men being the primary caregivers. That's Oakland Family Services. They have a daycare on site that allows for the parent to come in, do their groups, do their individuals, and also have the kids taken care of.
I got a couple more questions, Megan.
Sure.
One was about the withdrawal management. Is how long is that medication provided for?
For withdrawal management, it's typically 3 to 5 days. So for alcohol, it's typically 3 days, and then benzos, opiates, I believe that benzos, and I know I'm forgetting something, but alcohol is 3 days. All other substances are 5 days. And then if somebody were to maintain a MAT medication, because say they were receiving MAT for an opiate use disorder, but they were going into a residential treatment for alcohol use, they would receive their MAT medication for their entire length of stay of residential. It would be dispersed to them by the residential provider.
Okay. Let us know if that answers your question. Another question we have is, are you able to state what center is that you're speaking of that allows the children with the primary caregiver?
Yes, that would be Sacred Heart Clearview. That is our detox residential provider. And then at the outpatient level, that's Oakland Family Services. They have a program that's called the PRISM program.
Okay, great. Thank you.
Okay. Okay, so the sober support unit. The sober support unit, my goodness, I think we've had it going now for almost 2 years. The sober support unit is ran by Common Ground, and it is available to individuals 24 hours a day, 7 days a week. It is located at the Resource and Crisis Center. And again, when I say 24/7, that means Christmas Day, New Year's Day. It doesn't matter the time of day. It could be 2 a.m. The sober support unit is open and waiting to accept people in, but it's specifically for people who are at high risk of relapse, continued use. It's for people who want to access detox or residential services immediately. That could be the person who at 2 a.m. they were released from the hospital because they overdosed. And the person decides, I want help right now. It could be the person at 4 in the afternoon who just decided, I want help right this minute. Now's my time. Access operates during business hours. So the sober support unit is a great way where at any time of the day, any day of the week, a person can decide they want to seek the higher level of care services. They can come into the Resource and Crisis Center. They're triaged through Common Ground. Common Ground does a medical evaluation, as well as will evaluate mental health. We'll make sure they're stable. The person will go on to the unit, and then access comes in the next day, and we have the person from the time they enter the unit to the time they leave. We have them moved off the unit and in a provider within 24 hours. So if at any point in time, you're working with someone, whether they say they want the help or whether you see they're under the influence and you have concerns, and it's 4:30 on a Friday, oh gosh, but now what do I do? The sober support is available. It does not matter what county a person is from. They can be on the unit no matter what county they're from, as well as insurance status doesn't matter. Behind the scenes, we have a few more things that we have to go through. If someone comes to us from Lapeer County, it doesn't mean they can't be on the unit. It just means, well, if you're a resident of Lapeer County and if your Medicaid is from Lapeer County, then the sober support will help. If it's during the weekends, they'll help put you on the phone with the Lapeer PIHP to get you authorized for services. So anyone who's out of county or has a third-party insurance, behind the scenes, we do a few extra steps, but it doesn't stop someone from being on that unit when they need a safe place. We also have the RISE Center. The RISE Center is also located in the Resource and Crisis Center. The RISE Center is staffed by case managers. They are on site here to do just about anything that you could think of. If we need someone to apply for Medicaid, a person is able to do that. If somebody is in need of housing resources, they're able to assist with that as well. They do the polling of our third-party insurance individuals. Insurance can be very tricky for a lot of people to navigate. And so some people, and I say some, it's usually a small amount when we talk and they have third-party insurance when they call. Some will say, okay, I feel comfortable. I can call my insurance and get that explanation of benefits. And some are going, I need what? And so when that happens, we say that is okay because we have experts in that. And so we have the RISE Center. They will either do a 3-way call with the person's insurance company, or if the person's here on site and had just met with us, we walk them over, they get the benefits pulled, they get those numbers that we need, like the deductible and co-insurance and out-of-pocket max, and excuse me, and they help provide access with the information so we can help determine funding for them. They help give employment support, recovery support, excuse me, as well as short-term case management services. Any questions before I move on?
I don't see any questions in the chat. just a reminder for those on the phone, if you do have a question, you just hit *6 to unmute yourself.
Perfect.
And we do have one question
Yeah.
that says, where was the prison program, which I believe was at OFS, correct?
Yep, the PRISM program is located at Oakland Family Services in Pontiac. All right. Another service that we offer here through Access is our Veterans Navigator. And so our Veterans Navigator is Chaka McDonald. A veteran is defined as anyone who served in the military for any length of time and who was discharged with any status. That's so important for everyone to know that piece. Chaka really works with individuals and can help navigate any type of benefits they may or may not qualify for. Sometimes what we know the holdup can be is what someone's discharge status is. For Chaka, he's able to work with anyone. If they are a veteran, if they have served in the military, he is able to assist them with identifying any type of VA services they need, such as if they qualify for housing through VA funding, if they have benefits or do not have benefits, what do they qualify for. He works with community partners as well to help develop procedures and protocols within their own organizations of how veterans can better be serviced. And Chaka also works with the family members of veterans as well. If anybody's in need of veteran services, they can call our main access number. Very shortly here, we will have a Smartsheet referral system roll out. And that way, I believe in Oakland County alone, we have 18 hospitals. And so when you look at that and the amount of that's just the hospital system alone, that's not even within our own OCHN provider network. We have so many different community partners and organizations that may want to refer to Chaka. We found that besides just having a phone number for someone to call, that the referral system, it's a web-based electronic referral system. It will help ensure that no one slips through the cracks. Because we all know if we just give someone a phone number, you know, I might just toss it to the side. Whereas if a person is asked if somebody is at CNS or TTI or Easter Seals, which are our core providers, or if they're being discharged from Beaumont for any reason and they're identified as a veteran, and that social worker in the hospital is able to say, hey, you know, can I get you connected with a navigator who can help you with resources? I can put in a referral for you and put in all that information. Then when we receive it, we're able to call the person directly. And that way we ensure everybody receives the services that they need. Our hours for access. We operate Tuesday, Wednesday, Fridays from 8 to 5 p.m. Mondays and Thursdays are our late nights from 8 to 8 p.m. So a person can call the access main line during those hours. They can request the higher level of care SUD services. They'll get scheduled for a phone screening, or pardon me, they'll get scheduled for a screening. Right now we have moved to phone screening. Typically we do them face-to-face. And somebody's also able to typically walk in and also request services as well. And then for crisis services, Common Ground is our crisis service provider for Oakland County. And so it's always good that everyone is well aware of Common Ground and what they do. They have the Oasis unit. They also have OCRT, which is the Oakland Crisis Intervention and Recovery Team. OCRT will dispatch staff into hospitals as needed to do emergency assessments with individuals. Common Ground also offers victims assistance. They also oversee the Crisis Response Unit, also known as the CRU. They have a legal clinic, and then also they oversee the Sober Support Unit, also known as the SSU. And then for OCHN, we also have customer service. It links individuals to services who more on the mental health side when it comes to someone who may have closed out of a core provider within the last 365 days. They don't have to come through the access process. They're able to contact customer service who can get them realigned with their core mental health provider. They're also there to just assist people with any type of problem-solving needs they might have. And then, of course, if there's any questions, my contact information is listed on the screen here. I'm sure Tricia will also add it into the chat and have it posted later on as well. But my direct line, should somebody need something or have questions later, is 248-464-6242. And Tricia, do we have any questions?
We don't, but we'll open it up right now for that. We'll have, if anybody on the phone has any questions. I do want to let everybody know this is the second webinar in a series of 4 that we are holding. The first one covered an overview of the mental health services that we do. And then this one is specific for substance use disorder. The next one that I believe is in 2 weeks is on all of our juvenile services. And then the one that we will have in May is specific to access, where we get in a lot more in depth into accessing services and looking at what that looks like. So we wanted to break it up so that it wasn't too long of a training for everybody and really focus on those main points. So any questions related to the SUD part of any of this? I don't have any questions in the chat, and we'll give everybody on the phone a few minutes if they want to unmute themselves with *6, and then we can take any of the questions that you guys have. And I also, while we wait for a couple questions, want to see if Jody can unmute herself. We have Jody's contact information on the screen right now. And I know a lot of people that are on the webinar right now are in probation and parole. So I wanted Jody to introduce herself, a little bit about her role as well.
Good morning, everybody. Thank you, Tricia. Yes, I do know a lot of you that are already logged in, but I will just say hello. So my title is Probation Mental Health Systems Liaison. And basically what I do is I help bridge communication gaps and facilitate communication between our providers and the probation and parole agents and community corrections step forward in Oakland County. And so if you have issues or you need to help individuals get engaged in services or aligned with services and you have questions or concerns or issues or ideas, you can always feel free to reach out to me. Sometimes I get contacts about substance use disorder services. And so what I do is, since I'm the mental health liaison, I pass that along to our substance use disorder team. And I let them know, the concerns or what's happening with that individual. And also, one really big thing that I do a lot is if you have an individual that ends up in jail and you're unaware or you want to make their provider aware, you can always contact me. And then what I do a lot is I get emails and contacts about individuals that end up in jail that are already engaged in services, meaning they already have a case manager, they're already receiving psychiatry, and they happen to be maybe on the probation or parole caseload. And so I facilitate that communication as well. So please always feel free to reach out to me with any of those questions or issues or concerns.
Great. Thank you, Jody. We do have actually a really good question. With everything that's going on right now with COVID-19, are we actually in the facilities, Megan?
So in terms of where and how everything's looking right now, I myself am still working out of the Resource and Crisis Center each day. So that way, if we do have people who walk in the door seeking SUD services, I'm able to help direct them. They may be someone who doesn't have a phone, and I'm able to connect them with a phone and get them on the phone with a screener. In terms of services being provided still, all services are still being provided at an outpatient level, MAT level, higher level of care with detox, res, recovery housing. All services are still being provided. Some providers have limited their numbers to allow for social distancing to occur. And then as well, some providers are utilizing telehealth services. So we are still operational. Our providers are still operational with being able to service people.
Great, thank you. Well, I think if we don't have any more questions, I think I'll give it a couple more minutes just to see. But we will be posting this on our webpage, and everybody who registered will be able to get a link back to that. So I'll send that out, but that you're also able to find that on our webpage under provider links, and then there's a provider training. But we'll make sure that we get that sent out for all of you. And hopefully we will see you at our next webinar. So I'm going to end the recording here. And